Hi, friends, welcome to my YouTube channel Nursing Classes, a place where you get nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम वेस्टर्न कोलफील्ड्स लिमिटेड स्टाफ नर्स एग्जाम 2019 का क्वेश्चन सॉल्व करने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरी YouTube चैनल को सब्सक्राइब नहीं किया है तो सब्सक्राइब करें और बेल आइकॉन को क्लिक करें जिससे मेरे आने वाली वीडियोस का नोटिफिकेशन पहले मिलेगा। अगर पिछले वीडियोस नहीं देखा है तो प्लेलिस्ट में जाकर देख सकते हैं और वीडियोस के डिस्क्रिप्शन में भी लिंक प्रोवाइड करवा दूंगा। अगर व्हाट्सएप में वीडियोस का लिंक चाहिए तो पर्सनली व्हाट्सएप मी, माय व्हाट्सएप नंबर इन डिस्क्रिप्शन बॉक्स। अगर वीडियो अच्छी लगी तो एक लाइक कर देना और अपने दोस्तों के साथ शेयर करना। चलो अब शुरू करते हैं। A patient suspected of have pheochromocytoma complaining of palpitations, sweating and headache. Which assessment is essentials? A. Pupillary reaction. B. Hand grip. C. Blood pressure. D. Blood glucose. Correct answer C. Blood pressure. 27. Chemical burn of the eyes are treated with A. Local anesthetics and antibacterial drops. B. Hot compresses applied at 15-minute interval. C. Flushing of lids, conjunctiva and cornea with tap or sterile water. D. Cleansing the conjunctiva with small cauter tip applicator. Correct answer C. Flushing of lids, conjunctiva and cornea with tap or sterile water. 28. Which is the preferred site for intramuscular injection in infants? A. Deltoid. B. Rectus femoris. C. Vastus lateralis. D. Ventrogluteal. Correct answer C. Vastus lateralis. 29. All of the following are organs of lymphatic system except A. Tonsils. B. Thymus. C. Spleen. D. None of the above. Correct answer B. Thymus. These. The confirmatory test for diagnosis of tuberculosis. A. Sputum culture. B. Bronchoscopy. C. Tuberculin test. D. Saline test. Correct answer A. Sputum culture. 31. The first thing the nurse should ensure when the baby's head comes out is A. The cord is intact. B. No part of the cord is around the baby's neck. C. The cord is still attached to the placenta. D. The cord is still pulsating. Correct answer B. No part of the cord is around the baby's neck. But these. Which of the following is used to take cervical smear? A. Colposcope. B. Vaginoscope. C. Air spatula. D. Forceps. Correct answer C. Air spatula. 33. APGAR score is recorded at A. 1 minute and 5 minutes after birth. B. 5 minutes and 8 minutes after birth. C. 2 minutes and 5 minutes after birth. D. 5 minutes and 10 minutes after birth. Correct answer A. 1 minute and 5 minutes after birth. 34. Bottle-fed babies are fed babies to A. Cough and cold. B. Diarrhea. C. Impetigo. D. Tuberculosis. Correct answer B. Diarrhea. 35. Physiological jaundice in infants appears. A. At birth. B. Within first week of birth. C. In second week of birth. D. None of the above. Correct answer B. Within first week of birth. 36. Postpartum hemorrhage is loss of blood more than A. 200 milliliters. B. 300 milliliters. C. 400 milliliters. D. 500 milliliters. Correct answer D. 500 milliliters. 37. Sunken fontanelle is a sign of A. Dehydration. B. Hydrocephalus. C. Down syndrome. D. Turner syndrome. Correct answer A. Dehydration. 38. How long after administration of tuberculosis intradermal skin test the result should evaluated? A. Immediately. B. Within 24 hours. C. Between 48 to 72 hours. D. After 5 days. Correct answer C. Between 48 to 72 hours. 39. According to who, when should the mother start breastfeeding the infant after a normal delivery? A. Within 1 hour of the birth. B. Within 12 hours of the birth. C. Within a day. D. After the infant's condition stabilizes. Correct answer A. Within 1 hour of the birth. 40. Immediate complication of low birth weight baby is A. Intrauterine fetal death. B. Perinatal asphyxia. C. Pulmonary hemorrhage. D. Sensorial injury. Correct answer B. Perinatal asphyxia. 41. In HIV, window period indicates a time period between A. Infection and onset of first symptom. B. Infection and detection of antibodies against HIV. C. Infection and maximum multiplication of the organism. D. None of the above. Correct answer B. Infection and detection of antibodies against HIV. 42. The vitamin A nutritional supplement administered is to prevention of nutritional blindness in children contains A. 25000 IU. B. 2 lakh IU. C. 3 lakh IU. D. 5 lakh IU. Correct answer B. 2 lakh IU. 43. Safe strategy is recommended for control of A. Trachoma. B. Glaucoma. C. Diabetic retinopathy. D. Cataract. Correct answer A. Trachoma. 44. Disposal of expired and cytotoxic drugs as by A. Separate landfill disposal. B. Municipal waste disposal. C. Autoclaving. D. Chemical treatment. Correct answer A. Separate landfill disposal. 45. Primary health. Correct answer A. Health for all. 46. While catheterizing the bladder of a pregnant lady, the following fact about female urethra are true except A. It is about 1.5 inches length. B. It is posterior to vaginal orifices. C. It pierces through urogenital diaphragm. D. It is straight and offers minor resistance. Correct answer B. It is posterior to vaginal orifices. 47. Orthotoledine test is used for detecting A. Chlorine. B. Nitrites. C. Nitrates. D. Ammonia. Correct answer A. Chlorine. 48. Case finding in RNTCP is based on A. Sputum culture. B. Sputum microscopy. C. X-ray chest. D. Montu test PCR. Correct answer A. Sputum culture. 49. 6 months pregnant women came to hospital for consultation. Which of the following is contraindicated? A. Tetanus toxoid. B. Potassium iodine 200 mg. C. Ferrous sulfate 200 mg. D. Retinol to lakh IU. Correct answer D. Retinol to lakh IU. 50. JSY stands for A. Janani Social Yojana. B. Jan Suchir Yojana. C. Janani Suraksha Yojana. D. Jan Sulabh Sauchalay Yojana. करेक्ट आंसर सी जननी सुरक्षा योजना। कैसी लगी यह वीडियो कमेंट करके बताएं। अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना। एंड डोंट फॉरगेट टू सब्सक्राइब। थैंक्स फॉर वॉचिंग। सी यू इन नेक्स्ट वीडियोज।